Good morning, respected professors and dear colleagues. The others have no financial disclosure. Gonioscopy-assisted transluminal trabeculotomy is a recently developed circumferential trabeculotomy method that preserves the conjunctiva. Primary open-angle glaucoma and pseudoexfoliative glaucoma are the two most common subtypes of angle glaucoma. PXG typically presents with higher intraocular pressure, IOP, and often requires more surgical intervention. This study aims to evaluate changes in anterior segment topographic parameters following combined phacoemulsification and gut surgery in patients with POAG and PXG, and to investigate the association between these changes and postoperative IOP levels as well as the number of anti-glaucoma medications required. This retrospective observational study was conducted at Tertiary Referential Center. It included 22 eyes of 22 POAG patients and 29 eyes of 29 PXG patients who underwent combined focal surgery. Only eyes that received at least 180 degrees of gut were included. All patients underwent comprehensive ophthalmologic examination preoperatively and at 1, 3, and 6 months postoperatively. Parameters assessed included IOP, best-corrected visual acuity, and number of anti-glaucoma medications. Anterior segment parameters included iridocorneal angle, anterior chamber depth, and volume, were evaluated preoperatively and at 1 month postoperatively using sham fluke imaging. The relationship between topographic changes and surgical outcomes was analyzed. Glaucoma severity was classified according to Hodop-Parrish-Anderson criteria using Humphrey standard automatic perimetry results. The mean age was 69 years in POAG group and 71 years in PXG group. Preoperative intraocular pressure was 18 mm mercury in POAG and 20 mm mercury in PXG. The preoperative mean number of anti-glaucoma medications was 3 for POAG and 4 for PXG. The average gut extent was 347 degrees in POAG and 331 degrees in PXG. At 6 months, mean IOP was about 12 mm mercury in both groups. BCVA improved in both groups. Number of anti-glaucoma medications used decreased in both groups, as you can see these charts. Hyphemi occurred in 34 eyes, including 19 PXG and 15 POAG. Among this anterior chamber lavage was required only 6 eyes. Postoperative evaluations show significant increases in angle and anterior chamber depth and volume. Here you can see these changes in angle, depth, and volume. Angle widening was greater in PXG. In PXG eyes, increases in the angle and volume were negatively correlated with the number of anti-glaucoma medications. Here you can see pre- and postoperative anterior segment parameters changes. Combined focal is effective for open-angle glaucoma, yielding significant IOP reduction, improved vision, and less need for medications. In our study, IOP, number of anti-glaucoma medications, and BCVA all demonstrate significant postoperative improvements, highlighting the clinical efficacy of the procedure. Gut-enhanced aqueous outflow. The addition of phacoemulsification to gut provides a combined effect of anatomical improvement and enhanced aqueous outflow. In our study, significant post-operative improvement was observed in anterior chamber parameters and the iridocorneal angle. In PXG, this effect is more pronounced, with angle widening and volume increase correlating with the reduced medication use. Previous studies have reported significant increases in angle, depth, and volume after phacogut. Our study, by linking these anatomical changes to number of anti-glaucoma medications, showing that the angle and volume enlargement are not only structural but also clinically relevant for glaucoma control. Integrating anterior segment OCT into follow-up protocols in addition to topography allows more objective monitoring of angular changes and healing process. Large long-term studies will better clarify the impact of these changes on glaucoma control. Thank you for everything.
Hi.
Hello.
So how was the GATT extent determined? You mentioned 334.
We measured in perioperatively clockwise. Actually, my English is not good, but my senior is here. Maybe he can it's possible to answer your questions if you are okay.
And it's one question that you can answer.
Maybe.
You said 6 patients required lavage.
Yeah.
So were they all from the pseudo exfoliation group or from the POAG group?
It's equally.
3 in each?
3 each.
All right. Thank you.
Thank you for everything.
Okay, thank you, Ridvan. So our next speaker, or rather to present your paper, is Ilya Kazakov.
Hello, everyone. Valsalva retinopathy is a condition characterized